And I would say that in some ways, the lessons we've learned about trust and the ethical considerations in managing a pandemic are reinforcing of things that we had learned in prior pandemics, going all the way back even to before the 1918 pandemic influenza. But certainly, if you look over the last 20 years, coming into this pandemic, we had sort of a playbook. Not even sort of, we literally have a playbook on how, several of them, on how to manage a pandemic and specifically how to ensure the highest level possible of public trust in the public health enterprise. So, for example, there's supposed to be regular communications. These communications should be honest and transparent. They need to be coordinated across different agencies so you don't accidentally have, one group saying one thing and another group saying something else. They need to acknowledge uncertainty. And for example, one of the things that we had to relearn this lesson this time is from the 1970s. Actually, there was a pandemic in which politicians, the president at the time, sort of took the lead in communicating with the public. And unfortunately, what ends up happening when politicians rather than scientists take the lead on communication is that it automatically sort of polarizes the information that's being delivered because politicians are inherently they have a base and they have people who don't like them. And so for example, in 2009 with the H1N1 pandemic influenza, there was a lot of debate at that time about what role the administration, Barack Obama and his team, should play in public communications about the pandemic. And they sort of stood back and said, yeah, we want the CDC to have the regular meetings, to have the regular briefings of the public. And the reason for that was not because they couldn't have done it or didn't have the authority to communicate directly with the public, but it was because they knew that once the president steps into this, it becomes a political issue. So that was in the playbook to avoid the politicization of communications around the pandemic. That is not to say, by the way, that politics don't automatically come into play when managing a pandemic. I think one of the other things that this pandemic has really reinforced or taught us is that while everyone says they want evidence based and science based policies, the reality, of course, is that policymaking is both about evidence and it's about values. And so there are legitimate political considerations in talking about the evidence and how you apply that evidence in your society, right? Um, on the other hand, of course, you can't have overtly political interference in the evidence itself. So maybe a good example of this would be the mask issue. So I think it's completely legitimate to have a disagreement about the values behind a mask mandate requiring people to wear masks. So, for example, someone might say, look, a mask mandate might backfire because there are some people who will rebel against a mandate, but they would wear a mask if you just asked them nicely and consistently and made it easy for them to wear a mask. That would be that's a legitimate point of view, right? And that's about values. We can't, though, or we shouldn't, have a disagreement on the science behind masking, right? Because the science on this has become incredibly clear at this point that masks work. And so there's not really a legitimate scientific debate. There can still be a values debate. And when science and values come together, you're now talking about public health policy. Um, I will, as a side note on this, mention that the thing we most often hear about the mask mandate as a sort of the idea of a mask mandate is that this is paternalistic, that it's a sort of nanny state thing for the government to require us to wear masks. And I have to say that argument is actually not a great argument because a nanny state argument would be if the mask was just to protect you and we were forcing you to do something that protected you from others. But the idea of a mask, of course, is to prevent you from accidentally hurting someone else. So a mask mandate is more akin to putting up stop signs or having a speed limit on the freeway. Yes, those things prevent you from killing yourself, but mainly they're there to prevent you from getting into a crash and killing someone else. And even libertarians agree that we need to have stop signs and we need to have speed limits. Even though they might prefer to drive faster, they'll generally drive the speed limit because they know that that's a necessary thing for society to function well. Um, by the way, that gets me to the sort of the second point that I think may be of interest, which is there are lessons learned that are specific to this pandemic, but there are broader lessons that I think we're also learning from this pandemic that are applicable across all of society. So, one of the things we have learned very clearly from our response in the US compared to others around the world is that an effective response to this pandemic, this is a pandemic that caused every single state in the country to declare a disaster. So this requires a national, all of government approach. We're a country of states, but we don't shut down our state borders. So having an approach that varies from state to state is, akin to having a peeing area in our national swimming pool. So it just doesn't work. We need to be able to have uniform guidance that covers the entire country. And the reason we didn't is partly ideological. It's partly because there are people who believe that everything can be solved by the free market, and that states, as individual entities, should have all the power, and the federal government shouldn't have very much power at all. So that's just an ideological argument, which is counterproductive in a national emergency. Um, but it's also because our country is lacking a level of social cohesion and mutual trust as a nation. And the pandemic has really shown a light on the need for us to rebuild norms of social trust, norms of reciprocity, our ability to work together across party lines, across state lines, and so on. These are things that have really been highlighted by the pandemic, but they extend well beyond the pandemic, right? There are many other aspects of our national well-being that we won't be able to solve if we can't figure out how better to work together.